Hey everyone, this is Dr. Kanita here on another Araya Holistic podcast episode. And this is a live episode, and I'm bringing back Tina Brockett. We had it before during the all the Zoom podcasts we were doing.
Correct.
So just a little reiteration, Tina Brockett is the owner of Encompass Integrative Wellness. That's correct.
That is correct. That is correct.
So she is a dietitian, right? A nutritionist?
A nutritionist.
Okay.
Yeah.
I was just reading on your website, your bio again. But she does a lot of functional nutrition, focusing on how you are as a unique person. So everyone has a unique nutritional profile that need to follow. So I'm sure you've been busy the past couple pandemic years, right?
It ebbs and flows. It ebbs and flows. I think one of the things that the pandemic really did was point out to people exactly where and how important, rather, their health is.
Yeah, exactly. And just to give, I guess we're going to talk about a lot of topics.
We got a lot to talk
about. So definitely listen to the whole episode. We're going to talk about teenage nutrition.
Correct.
And a lot of questions I got on my social media was about constipation, reflux, very common issues.
Yep.
What to do about that, some holistic methods. We'll talk a little bit about colds, what happens in the winter weather, some overrated, underrated foods as well. I'm trying to remember all the top of my head.
You had a lot.
Yeah. Hopefully we can fit in an hour.
We'll see.
Or just bring her back for another episode, so it's fine. But Tina Brockett, we met in Frederick a long time ago through a mutual friend. And ever since then, we've been best buds, and we just talk about all the fun things. I ask her a lot about nutritional stuff, and she asks me a lot about Chinese medicine, and we kind of see the overlap with those two, especially with how functional nutrition looks at food. I think it's kind of similar to Chinese medicine. We just have different vocabulary for things.
Yeah, and that's honestly what they're beginning to find out. Like if you are looking at the Chinese medicine approach or the Ayurvedic approach, these approaches have existed for thousands of years. And now we're figuring out that the science behind why they work, why they're important, what chemical components make them applicable to today's world. It's really kind of fascinating stuff.
Yes, and then we're over here going, we knew that. We're like, oh yeah. And this actually brings me to the article you sent to me. So it was, I think, an article that talked about how cold exposure makes you more susceptible to having a cold. And I think I read over the study. It was basically that what it said was when there was a drop in temperature by only 7-10 degrees.
Something like that, 9 degrees, something like that.
Yeah, it actually changes the... I guess, could we call it microbiome in your nose, sort of?
Yeah, I guess you could. But it's essentially the immune response in your nose gets completely kind of obliterated.
By 50%.
50%.
Yeah, and that's kind of crazy. So in Chinese medicine, we talk about that a little bit, how when it's cold, you got to cover yourself up. And the video that I have on my Instagram talked about my scarf.
Which I want you to know I wear mine.
I know. I saw. I'm very happy to see that, especially today on our windy, snowy day coming in. But yeah, so it talks about the nasal passages. When there's cold exposure, you get all the antiviral little critters get totally obliterated, which is kind of insane. So they talk about wearing a sweater over your nose, which is be kind of hard. But
that would be a little difficult. But I mean, it also begs the question, right? We're in the Northeast and we've got a really cold, blustery day out. But, one of the things that came to mind when I was reading it is looking at even when we had episodes of increased sickness in places like southern Florida in the middle of summer. Well, what happens in the middle of summer? You go outside, it's really hot. You go inside, and if you've been in Florida, they jack the air conditioning like nobody's business, and it's really cold. So just part of me wonders, even just that change in temperature, what does that do as far as the antiviral capabilities in the nasal passages.
Yeah, Chinese medicine, we talked about that too, because now in the summertime you can get exposed to cold because of the AC of the modern technology we have now. So you can still get sick in the cold during the summer, which is very out of character, because Chinese med looks at things seasonally. But yeah, going back to like when there's a drop in temperature in the wintertime, what do we say in terms of Chinese medicine? To wear a scarf. We have like a special point in the back of our necks that protect us. And I try to tell people like, oh, like viruses don't travel like that. I'm like, you have to think of it as this is like a totally different medicine, right? So we have different languages, and you can't think of it from you can't put on your Western lens. Hat or lens and look at it and be like, oh, that doesn't make sense. It's like, no, we just have a different way of saying the same thing. And the nasal passages is connected rightfully to our lungs. So our lungs we describe as like this very delicate canopy. So it can easily get influenced by like the wind, even like you have the cold wind, but even like heat too. We can have summertime, or if there is like more heat exposure, you can get a wind heat pattern versus a wind cold. So the difference would be like someone, for example, that might have a wind heat would have like more severe sore throat, really burning, itchy eyes, itchy nose, more like redness. And the wind cold would be like more like runny, clear. And then also the other person when heat would have like more yellow, because that's when some more heat has been produced. But the wind cold is like more runny. They're more pale, more scratchy throat. So it's not like necessarily a burning sensation, but the scratchy throat, where it just feels like some postnasal drip. So you can have those two differences as well. So when that came out, it's like, oh, we need that. That's a thing. You got to, make sure the lungs are warm and keep them safe, keeping yourself warm, avoiding like, also not like overheating too much, like that's why they tell you to wear in layers so you can take off.
Right.
Wearing a hat is always good too. And that brings me to also, I got the question of like ice baths and all that stuff. I don't know how much you know about ice baths or just like your research on it.
I know a little bit about ice baths, and actually, kind of the combination of again, temperature changes, kind of igniting health benefits, either going to ice baths or even doing things like a sauna.
Yeah.
If you're taking the body to extremes, it's actually that variance rather than just necessarily one thing or the other as far as health benefits, and they produce different but sometimes similar health benefits.
Yes, I know like Wim Hof made it kind of famous. Everyone was like, oh, everyone should do cold showers. I'm like, no, I don't really want to do it. But I can understand because like I think from a Chinese medicine perspective, if you were like a robust person doing that, and let's say, I think most people understand the concept of like yin and yang, right? So the yin is more like, I want to say dormant, but it's like the moon side, the cold, and then yang is more like heat, sun, like alertness, and yin is more like, you're more tired. Or I shouldn't say more tired, but just like the more relaxed state, let's say that. So when you take the cold shower, it almost brings the yang energy out, I think, because it like wakes it up. So I can see, okay, from that perspective, maybe that's what it does. From a chemical standpoint, what I've learned is it's more about like cell adaptation, like you mentioned. So like strong cells are actually cells that can adapt to certain things. So if you did like a cold plunge and then you went to like a sauna or vice versa, which I've done is like do like something really hot and then
do a plunge or something very cold.
You actually release I'm getting very like sciencey here, right? Like sirtuins. So sirtuins help with DNA silencing, repair, regeneration. So they're really good.
They're NAD dependent.
Yes.
Enzymatically dependent.
Yes. Yeah. So they're super, super good for you. So higher levels are also very good. So that cell adaptation of going the cold exposure heat releases more of that. The other thing that also releases is hyperbaric oxygen therapy, actually.
Which I am so excited to try out.
Yes. So I have that in my clinic, but that's, we don't have to go into that now, but that's like another thing that sirtuins can be released by is the oxygen therapy. So that's really cool. So that was like a fun little article that you sent me, but we can get into kind of like your realm of nutrition.
My realm of nutrition.
Yes.
Okay.
So I have to go through our little board because we just talked about a lot of stuff. And our first topic is food as medicine. And you wrote that in terms of, and I think my friends told me too, in like medical school, they spend like 2 weeks, maybe, lifestyle nutrition.
Yeah, they're not traditionally, and it also depends on when whomever the practitioner is went to school. I think now you're seeing a lot more focus on food and the importance of it and the incorporation of that into various programs. But, the big thing that I try and get across to all my clients is that food, just like any type of medication you take, it has chemical components. And our chemistry is affected by the food that we eat, positively and negatively. And that's where the power of food becomes somewhat underestimated. I have a client of mine who developed an abscess and was hospitalized for this. And her doctors do not understand how she healed the way she healed. She doesn't have a scar. And she came to me and she, she's like, what do I do? This happened. She was really freaked out. And I said, here's the list of everything you need to heal. This is what we need to provide your body, da-da-da-da. She said she gave the list to her husband. She's like, my husband was like, I don't know about all these fruits and vegetables. This is weird, whatever. And to this day, her doctors are like, tell me what you did. And she said, I ate really well. You know what I mean? So, it gets to be underestimated, but yet when you look back at traditional cultures, not only are there lots of rituals around food, there are lots of healings that happen as it relates to foods and herbs and spices and, all of that. Even those traditional remedies, like I know one of the things that's on your list is oregano oil.
Yeah.
Was one of the foods that you would put out there that, kind of that we wanted to talk about. But what they're going back and they're looking at these ancient texts from medieval times and recreating these recipes based on these essential herbs to discover why they were out there in the first place and why they were effective back then as a natural medicine. So we have the tools through just food. And it can be very healing. It can be used to help heal the body and support, things that we want to do and longevity and all sorts of stuff.
Yeah, and I think that to your point with if you provide the correct fuel for healing and like real foods, right? Because
foods.
And we talked a little bit about this in Chinese medicine too, specifically like, for example, diabetic patients. And there's this term that my teacher uses with them is like crappy blood, and it really just means someone's blood that's sluggish. And a lot of the times it's because like maybe those people don't eat real foods. And she talks about how like, I mean, this is gonna sound a little esoteric, but I think it makes sense to me. Like there's like our DNA or like what we eat, there's like a template that our body understands how to extract nutrients from those foods that are real foods that have a template.
Yes.
But then when you're ingesting stuff that's not real, our bodies are like, I don't know what to do with this. So then what do? It stores as like adipose tissue, stores in stuff that's like toxic that our bodies can't handle. And then, we don't get enough nutrients. Our blood doesn't flow well. The blood is like this slush. And she talks about that. You see diabetic patients, right? They don't have good circulation. I can tell too, their skin is really different. It's because they can't extract the correct nutrients from the correct foods, or like they're just been eating not real foods for a long time.
Yeah.
And their body just compensated this way.
Yeah, and I mean, that goes back to, there was a recent thing put out on a study that was done that showed that a diet in high and ultra processed foods leads to like significant cognitive decline, right?
Yes.
And so what does that mean? And what does that picture kind of look like? So what they found is in as little as a 20% of your dietary intake. So if you figure like 2,000 calories a day, that's 400 calories, right? If you were to eat that daily, so for some people, that might be just a McDonald's cheeseburger and a Coke. That's it. That's 400 calories. That's actually more than 400 calories, depending on the size of the beverage you get. But my point being, 400 calories is not a lot. You can get that very easily in one sitting, and that can affect your brain power and your, you know, your ability to function. And that's just food. You know, so going back to that principle, the food you take in can either have a positive or a negative effect on you. So the choices you make, they have repercussions, you know, in good ways and in not so good ways. It's just kind of amazing.
Yeah, and I think going back to also the other point of like these are the foods that heal you, and like a lot of people underestimate that, but then there's also foods that like almost are like a drug, right? That just like make you more addicted, and those are like also in a way like I don't want to call certain foods a drug, but some of it is like very addicting, right? I don't want to call it that. That's not what it is.
Yeah, because there's a lot of controversy out there regarding whether or not food is addictive or not. But from a behavior perspective, at minimum, and certain effects different foods have on your brain, positive, give you, you know, positive, happy feelings. I mean, we're designed and programmed to have a positive response to food that we take in, right? So as a result of that, then from like an evolutionary perspective, we want to go out and seek to eat more food, right? Because if you have a negative, your body is automatically conditioned to avoid things that cause negative reactions.
Yeah, that makes sense too. So many things that can go.
So many things.
Yeah, and so I actually wanted to ask you, and I spoke to you about the last time about food allergies.
Yeah.
So I actually did take a food allergy test because I was curious. Not that I had serious reactions and stuff, although when I did cut out, before, you know, we started this, I cut out like gluten and dairy.
Yep.
And coffee too, which actually helped my my brain function. But the dairy, I think, was a huge part in like, I was like, oh, I noticed quite a difference cutting that out. So I did the food allergy test, and the biggest thing that I was like, oh no, I don't know if eggs. And I like freaked out for a second because I was like, oh my God, I eat so many eggs. I love eggs so much. What do I do? So I ran to Tina.
So one of the questions you asked me was, how valid are these tests?
Yes.
And there's a lot of, I'm not going to lie, there are a lot of controversy about those tests. There's also some controversy out there because a lot of people are doing, you know, those at-home tests, and then they get these results back. And sometimes, I got to tell you, clients will bring those results to me and they're like, you know, half an inch thick, and they say, I don't know what to do with all of this. I'm overwhelmed. And the thing to note is you have various levels of immune responses, right? So if the test is a blood spot test or a serum test where they are actually drawing your blood at a location, you're going to get more accurate information than other tests that might be available out there. If they're measuring things like IgG or IgE, those are immune responses. Your IgE is your actual, like, true kind of like allergy response. And some of those tests actually offer IgE for certain foods. Others do not. And then IgG is more of like a sensitivity. So how do you use those tests? Well, they can be overwhelming, right? Especially if you pop positive for all sorts of foods, because then it's kind of like, what can I eat? I can't eat anything.
Yeah, I think mine was like IgG, maybe IgA. I can't quite remember. I remember the IgG though.
Yeah.
IgE. Yeah, those are the two.
Yeah.
I remember.
So the thing of it is that if you aren't eating the food, right? This is measuring your response to foods that you're taking in. So if you're taking in large quantities of foods, you might pop higher for things. If you are not taking in the food at all, it may not even register.
Yes.
Right? And we talked about this. My husband has a legume allergy. He took one of those tests. He's like, why am I not testing sensitive or anything for legumes? And I said, well, because you haven't had them since you were 11, you know?
Yeah.
So when people take them, I say, eat your regular diet as you normally would so that you get a true assessment as to where things are happening. Yeah. So what does that actually mean? When somebody shows up, and this is how I use these tests, because there's a lot of controversy on them, I use them kind of as a guide, not an absolute. Now, clearly, if you have an IgE reaction, that's a very significant reaction. That's one thing. If you are showing really positive on a bunch of things for various sensitivities, like your eggs, I look at the various nutrients that are being ranked in different tests have different rankings. So you can have like high, medium, low. So if it's a high and you have a bunch of high things in there, depending on what other characteristics are going on with you, if you're having digestive issues, if you're having other issues, going back to your question about leaky gut, that might be an opportunity for a period of time to kind of hold off on those things and then reintroduce them, but reintroduce them on a rotational basis. So you wouldn't eat everything that would potentially trigger you at one point in time. Okay, so the reason I take these reports in hand with kind of a more objective view is because each of those foods has within it various nutrients. And if somebody is, and I had this happen once, a client came to me and honestly, that particular test had a red, yellow, and green category. It looked like a Christmas tree, you know, like everything was, and she's like, what am I going to eat? And so what we did is we took a very conservative approach. The first thing we did is anything that was in the red for a period of time, we eliminated it, and then we were taking it in and bringing it in like dose dependent things where she wasn't eating everything that she had previously tested in the red zone for all at one time. And then from there, incorporating different foods in a rotational basis. If you are bringing foods in, and this goes into that whole idea of like an elimination diet, bring them in one at a time, and you wait like 3 days. And I know that sounds crazy, but you do. And then that way you can assess, how is your body responding? Your body is always talking to you and communicating in some way, shape, or form. And if it is communicating negatively, then you know maybe that's just not a food that you bring back in on a regular basis, or if at all. You know, you said you noticed a big difference when it came to dairy.
Which I think in my test, it was actually just moderate. It was actually just yellow.
Right.
But the red one was actually the eggs, and I was like,
but really you were consuming more eggs than you were dairy, but really it's utilizing, I use that as a guide, not the be all end all. Because some people are like, I got this test, so I can't possibly have these things. I'm like, well, time out. Let's really look at that and make sure that that's accurate for you, because you don't want to cut out whole categories of food.
Okay, that makes me feel better about my thing. So my understanding is it's not the be all end all, it's just a guide of like, okay, let's see,
like, where can you start, because there's so many areas to start with. Where can you start?
And I think to your point too, it's like, oh, you asked me like, okay, do you have symptoms like when you eat it? I'm like, no, not really. And I was like low on like wheat, right? And I wasn't eating gluten for a while. I really don't have, even though that's low, I like culturally, I just don't have a tendency to eat bread or pasta that much.
Right.
So that wasn't hard for me to eliminate. And I'm like, I don't really need it. Probably dairy was my huge thing to eliminate. That helped a lot. And I randomly had like buffalo's milk. That was so random. That was on there. Banana was another moderate one. Which is interesting. And I was like, well, I can kind of, I don't eat that a lot, but I'll just take it out and just see. You know, I just change my fruit. So that wasn't a big deal because I used to just mix it with my shake.
Right.
So to your point, like just listening to your body on what foods you're eating, if it's like a high sensitivity, and just seeing like, okay, am I feeling worse? Like and usually people can tell by like, for me, it's my mental state is a huge factor. Like I can definitely tell if I ate something, especially fried foods. Like I do not eat fried foods anymore because I immediately feel like fatigued, tired, like my eyes are like ugh, and stuffy. And same thing with dairy.
Interesting.
So like my mental cognition changes. And another thing is like the congestion I'll notice.
Yep.
I don't really have any other indications. Some people notice like with pain, a patient that when they eat certain things, they feel it in their hands.
Yep.
In their joints.
Yep. And these are all signs of inflammation, right? Yeah. That stuffy nose, that foggier brain, that headache, that increased joint aches, feelings of irritability, feelings of just off, higher levels of anxiety. All of those are indications that inflammation is rising in your body. And inflammation is kind of like sometimes also this cup. Yeah. You know, you can tolerate a certain amount, but if it flows over the cup, then you have a real problem. I had a client once that was like, I can't understand it. I can tolerate this food at this time of year, but I can't at this time of year.
Okay.
Well, it boiled back down to in the spring, she had really significant seasonal allergies. So anything that she put on top of that was her threshold of tolerance to handle those foods, put her over the top. She was miserable. But in the dead of winter, she could eat them because she didn't have the seasonal allergies.
Oh, interesting.
So this is why I'm saying you really have to listen to your body and really get to know yourself and what works for you, which is where that idea of personalized medicine, personalized nutrition comes into play.
Yeah, I love it.
I do too.
And this is actually, I just made a connection as you were talking about all that. I
feel like a light bulb.
Yeah.
Just went up off your head.
You should put a light bulb in there.
Yeah.
Put a light bulb. Because I made a connection of like, we talked about cellular adaptation. And I think everyone has a threshold with that. And if you improve that, you can improve how well. And I think it's like, I was reading stuff about hyperbaric when I was reading research of like, there's a threshold of how much toxins you can take. Yeah. So there's like ways to detox, and like you said, there's like we have this cup of like how much our body can
handle.
And so how can we improve that too?
How can we improve that through food, acupuncture? Yeah, I mean, you know, I tell people that I come to my acupuncturist and they're like, what hurts on you? I was like, I just come in for a balance.
Yes.
Like I just come in to balance my system and my body.
Yes.
It's part of my routine. And what I think is fabulous is I've got my, 16, now 17-year-old daughter who comes in regularly.
Yes, and she takes the needles. A lot of people are like, they're so scared about that. And I like to say that you don't need to have anything to hurt to get acupuncture.
No, and that's my point, is when I tell people, I'm like, go to Kanita.
Yeah.
Trust me, it will help balance you out. And they look at me like, what do you mean? And I said, we're all these energetic beings. There is a lot of science behind acupuncture.
It's a 2,000-year-old
I
medicine.
know. I'm like, it's been around for a while for a reason. And it's just another tool in the toolkit that we can utilize to help balance ourselves and live well.
Because like, especially if you live in Montgomery County, you're always in this sympathetic fight or flight system. So acupuncture has been shown that when you do it, it puts you into a more parasympathetic state. More resting, and to like really decrease all the stress, hormone, cortisol, all that stuff in those treatments. So everyone feels like people like they don't believe me when they're like, I fall asleep. There, I have patients fall asleep with needles, and they're like, "How?" I'm like, "Oh, you'll find out." I do all the time. Like, but I don't need that much too. But we can move on next. I feel like we can talk about a lot of stuff in depth.
We could.
But so we talk food. We did like one topic.
I know.
Like 30 minutes. But let's talk about because I really think it's important to talk about like teenage health.
Okay.
What do you think is important for growing teenagers to focus on in their nutritional health? Especially, I know your daughter does a lot of activities, a lot of athletic stuff.
And she eats a lot of food.
Yes. So what's a good amount? Like, I think, parents don't know how much protein or what foods they should feed their child as they're doing other activities. The importance of like breakfast.
So working with kids, especially teenagers, is incredibly, incredibly important. And I actually recently approached my son's college offering to give a free talk on nutrition because it plays such a role not only in their physical performance if they're an athlete, their academic performance, but also, setting them up for success as a young adult and later an adult, both from just a health perspective, their microbiome perspective, their hormones, like everything comes into play. So as far as nutrition goes, one of the big things that I think is underestimated, and I admit it, when I was a teenager, I did the same thing, is not eating breakfast. Because they're in the rush to get out the door. They don't feel like
I think school's too early for kids.
It is too early for kids.
Like for me, I was like, how did I wake up at 5:40? I used to wake up 5:45 a.m. like psycho. I can't do that anymore.
But what they show is that there have been studies in teenagers that their anxiety and depression goes down, especially if they eat breakfast. They perform better on tests if they're eating breakfast, and which makes sense, right? Because your primary fuel for your brain is glucose, and that's what everything converts to. So that's breakfast, incredibly important. Whole foods. From a variety of reasons. I get teenagers that come to me and they're all upset because they've got some acne going on and whatnot, and they have these afternoon crashes and all they're doing is eating carb. The problem with that is those carbs feed the not so great bugs in your body, causing the acne, that imbalance in the microbiome. And those fruits and vegetables will help fuel them in a variety of ways. So addressing acne with good whole foods rather than a reliance on convenience foods, heavily processed foods, that type of thing. Again, that begins to set them up for success later on, and they need to be foods that are readily available, right? I don't know about you, but if I've got a veggie tray where everything's already cut up and ready for me, I'm going to be more apt to eat it. If I have to reach in and I have to cut something up, it's going to be lower. So the baby carrots, I love the multicolored baby carrots. They're so cute. And they've got different phytonutrients in them because they're different colors. Baby cucumbers, there are ways.
Little vegetable.
Baby vegetables. Baby corn. So there are ways you can make it easy for a teenager to grab and go. The next thing is bone health. Bone health is incredibly important. I work a fair amount also in the eating disorder population. I get a lot of female athletes. And they do, they have more restrictive eating potentially going on, and or a very hyper focus on things that are only nutritious but at the expense of other things. So bone health is really important. Between our 20s and 30s, we reach our peak bone health, and that sets us up for the rest of our life. In women up to age 18, I think it's 90% of your bone is ready to go. And so with hormonal changes that happen with women, you don't want to set yourself up for osteopenia, osteoporosis. Restrictive eating tends to set people up down the road because if they're not eating enough, they pull the nutrients from the bones. So for teenagers, male and female, really focus on bone health. That gets into also getting their vitamin D levels tested. At this time of year, most people's vitamin D levels are lower. See what's going on with the vitamin D levels. Make sure they're getting enough of those things like calcium and vitamin D and K1 and K2 and magnesium and things that build healthy bones. As far as fuel needs vary based on the student or the young person. As far as protein goes, you can have, I think the RDA is 46 grams for a female and 52 grams a minimum for a male. But those needs can change and increase 2 to 3 times depending on the amount of activity they're doing, right? So protein is like 10 to 30% of caloric intake. And if you were to take somebody that is doing a 2,000 calorie diet, and maybe they're not active at all, their needs are going to be very different than somebody who's doing a 3,000 calorie intake and they're playing a heavy duty sport. You know what I mean? They may actually need more than 3,000 calories. So that proportion of that goes to protein is going to vary. Protein needs also vary based on height and weight. So it's really individualized. But I gave you the RDA as like the bare minimum.
And then it's all just based on the activity level that they do, their body size, constitution, like Chinese medicine.
Just like Chinese medicine. Imagine that.
Just to reiterate your point, so what I'm understanding is bone health is critical, especially in women.
Yes.
From 18 to 20. So like, you know, you can't go back. It seems like seems like very critical time to be able to eat well, eat enough, don't be restrictive.
Yeah, don't be restrictive. And because if you're restrictive, your body is going to pull those nutrients from somewhere.
Exactly.
It'll break down your muscles, it'll break down your bones. And then that kind of sets you back. You know, that's why physical activity is really also incredibly important for bone health as well. You know, all of that activity, the gravitational impacts of various activities, strength training, if you're going to be doing that, even the muscle movement helps with, you know, the health of the bone and formation and all that.
So would you say that doing those during that time period for females and males, so if you, let's say if someone like was really restrictive and wasn't doing eating whole foods, trying to be restrictive with their diet, and during that age, so that wouldn't set them up for later in life very well. Could they come back from that, or would that be just more difficult, you think?
I think for some people it really, and people hate when I say this, but it depends. There's a lot of it depends. You know, if you are somebody who has a lower or smaller bones to begin with, etc., there, you know, that may play a role in it. If you've got certain family history, all of these things come into play. Can you recoup from that? Absolutely. But you're kind of put behind the curve of things that you have to make up for, you know, but like anything, right? The longer your body, and that's the other thing, how long has the restriction been in play? What age did it occur? What is your, you know, they can do a bone scan, like a DEXA scan, and see where they currently are. But, you know, I have women that are in their 30s, late 30s, and they're got the precursor to osteoporosis. They're osteopenic.
Oh, no.
But they had a history of significant period of time of restrictive eating.
Interesting. Yeah,
correct.
So definitely important. And would you say that, and I was just listening to another, actually, like, I think Dr. Huron podcast, he's talking about male health, and he said it's like checking for vitamin D levels when, you know, they're 16, 18, I think it's a good idea. It's
a really good idea. It's a really good idea. But unfortunately, a lot of insurance companies will only cover it, if they cover it at all, it's once a year. There are alternate ways to get your vitamin D levels checked, but it's a good thing to know, like, as a baseline, where you are in the winter, where you are in the summer, so that you understand kind of where you are. And I'm having kids come to me where their vitamin D levels are 12 or 19.
Oh my God. Which is not normal, guys?
No, it's not normal. I mean, I like to see it between 50 and 80.
Yeah.
So it's a very big difference.
So if you, like, just insurance level aside, or if you had money, you didn't have to worry about that, what blood tests would you have parents take for their kids?
So I would get a baseline, like, panel done. I would get your vitamin D levels as a baseline done, like I said, at different seasons. If it is low, work with a practitioner. and do some supplementation, or you can also eat vitamin D rich foods, and get your levels reassessed at a 3-month mark, right? Because, I get a lot of people that come to me that say, and this is all ages, right? I was low in vitamin D. My doctor put me on 50,000 IUs for a period of time, and then I stopped. I'm like, well, how long ago did you stop, and what were your levels after you did the 50,000 IU? And they're like, well, I stopped 3 months ago, and I don't know what they were. So we don't know how much that 50,000 IU raised their vitamin D levels, because vitamin D also, like how much it gets raised, varies by person too. So that's where you need to test, retest, find out what's going on with your body and your unique situation. And once you figure that out, based on the seasons, based on what you're exposed with out in the sunlight and everything else like that, you can then have that as a guide for how to proceed forward. But vitamin D, like they did a bunch of studies relative to it, even in COVID, and part of me wonders as a practitioner, what were everybody's, for the people that had more restrictive, or not more restrictive, but more severe cases of illness, because vitamin D plays a role in the immune response. What were their D levels like? As a baseline coming in, and how did that fare to somebody who maybe had a very mild case? Like what, or frankly, I would love to see a whole like nutrition panel have been done on everybody. If I could go back, just because I'm just curious.
That'd be something to look into. I don't know. Maybe someone need to do it. But that's really awesome. So, bone health in teenage years, not have a restrictive diet. If you can, checking vitamin D levels, seeing where they're at, and then taking supplementations in conjunction with the practitioner. Checking 3 months, right? Don't just take it and then not recheck for...
and don't just take it willy-nilly, because I have people that take... it's a fat-soluble vitamin. So
you have too much.
You can have too much. So you don't want to just, I had somebody who came in to me and they're like, I've been taking 10,000 a day. I was like, whoa, let's talk about this. How long have you been doing it, and who directed you? Well, I just thought it would be a good idea.
My practitioner actually told me to stop because I got to like 80 and she's like, all right, you're good. Like, so I was like, oh, okay. Like I thought I had to keep taking it to maintain, but lately it's been okay, and I'm take it during the winter time.
And that's why I'm saying, like, once you know kind of where your levels are and what it takes to keep your level where it is, you're golden. But it's figuring out that.
This is good stuff. I love it. All right, before we get too off topic.
I know. We could talk for
days. I know, but let's talk about a little bit of common issues that I'm sure you've seen and I've seen, and people ask me. Constipation's one of them, and acid reflux.
Okay. So constipation. Constipation's huge. So the big thing that I see with a lot of my clients is some of them come in and they don't really understand that they're constipated. And when I ask how frequently they have a bowel movement, they may have always had a bowel movement every 3 days or so.
That was me. That was so pointless.
But
not good.
So, there are a variety of reasons for constipation. And then ideally, people say, well, how often should I have one? I'm like, well, I'd like to see 1, maybe 2 or so a day, if not more. But they need to be healthy. I don't want you to, have diarrhea. That's that's taking things the opposite direction. But, when you're dealing with a heavily processed diet, you're not getting the fiber you need to help move things along. So that's a piece of it. The biggest thing that I see is lack of hydration, because people are so busy, they don't think to drink water. They aren't eating enough fruits and vegetables, which are inherently filled with their own water. Right? And
plus fiber.
Right. So I'm like, okay, well, this is a problem. But a lot of people will come to me and they're really dehydrated, and then they drink a lot of caffeinated beverages to keep them going because they're fatigued, not realizing that being dehydrated could actually make them feel more fatigued. So dehydration, heavily processed foods, not enough fruits and vegetables, as simple as that sounds. very sedentary lifestyles. I mean, we were never designed to be as sedentary as we are.
Yeah. Makes sense. So movement.
Yeah. And I mean, in some of the protocols I have actually show different body movements that you can do to help kind of massage the internal organs.
We have like twin techniques, right? And you use like, babies that are more constipated. Yeah. Like, because like our whole intestinal tract is like this windy thing. This windy, very long, right?
Yes, very long. And some people it's longer than others.
Exactly. We don't know. Some people have extra stuff. Some people don't. I've heard of that too.
Yeah. Really you can actually end up with constipation if people have been relying on laxatives for too much.
Yes.
So there are a variety. Oh, and medications. Medications are huge. So, people may or may not know, like opioids definitely, but anti-nausea meds contribute to it. Antihistamine medications.
Drying up. That makes
sense.
Yeah.
Right?
Yeah.
Blood pressure medications often have diuretics in them, drying up, right? So if you're not drinking enough water and you're taking some of these medications, even if they're regular everyday medications or even NSAIDs like Advil, that can be, those can be constipating. And you're not drinking enough water, and you're not eating enough vegetables and fruits or whatever, you're setting yourself up for a real significant issue. And, when I work with people, especially women, we metabolize things like estrogen, right? We want estrogen to be metabolized, packaged up, and out of our body. We want, if they're coming to me with cholesterol-related issues, I'm like, you want to package that stuff up and you want to eliminate it.
Yep.
And that's where getting people going to the bathroom so incredibly important.
Yes. And there's only a few ways we eliminate stuff. And in Chinese, we talk about that like either like pooping, and you sweat.
Yep.
Or what's that one? I mean, you can vomit, but no one really wants to do that. That's only like severe cases, like right when if you need to do that. But obviously, the main things are like sweating.
Yeah.
That's why actually saunas are pretty useful in that way.
Yep.
If your pores are blocked, that's also not a good thing. So I do have patients that don't sweat. They're like, I don't really sweat that much. Or I feel like I don't sweat. That's not a good thing because that's actually how we eliminate certain things.
That gets into to your point of not sweating. I mean, if they're having thyroid-related issues, hypothyroidism, or even what is called subclinical hypothyroidism, which is often underdiagnosed, not diagnosed at all, that can contribute to people having these issues. So, some of the best things you can do, I mean, and I know it sounds crazy, but even looking at things like what your form is when you're going to the bathroom, like the squatty potty, looking at
newspaper. That's what some teachers said that in like Chinese medicine. Like, it's like a newspaper, what's going on in your body. Because I think we're designed to like look at it too, because then it tells us if something is wrong.
Well, and you think about it, and let's take a step back. Like, you have dogs. I have dogs. I have an elderly dog. And every time she goes to the bathroom, my other dog comes up and he will mark over. But I think he smells it, he looks at it, he analyzes it, and then he marks it. And he will do that with her urine as well. So, I think we are designed to look at it. It can tell us a lot. My kids tell me I talk way too much about poop, but you can. I mean, the color, the shape, if there's undigested food, if there's an oil slick, like there's so much out there that it can tell you.
Yeah.
But you need to actually be going in order to see it. Yes. And if you're not, that's a problem.
And that's like, if you think about it, that's just like fermenting in your body.
Yes.
And that's something that
and
you don't
more
want.
Toxins and things like that.
Oh, yeah, urination does the other thing. The other way we eliminate things, urination, sweat, and pooping. So 3 things you need to do, to always make sure your body is kind of cleansing itself.
Yeah, and functioning correctly.
Yeah, I look at my dog's poop all the time. Because I'm like, okay, is it good? All right.
Is it good? How are we doing? What's going on? All right. And if it's not, I mean, that's why I think, because he didn't used to do that, but as she's gotten older, he does. And I think it's like to kind of mask the fact that in the pack, there might have been somebody who's elderly and maybe she's not as robust.
So he's
protecting her.
It's so crazy. Dogs.
That's my theory. Yeah. I'm not of that. whatever. But
I like that theory. Same thing when like we go to the bathroom, our dogs follow us because we watch them pee and poop all the time. So they're like, they want to watch us, and I'm like, oh, I guess that makes sense. And they protect us.
It's a pack. Yeah, it's a pack. They're pack animals.
Anyway, this is like a fun fact. But the other, not really other side, but the other question I get a lot is like reflux. So what's, like, as we know, people who get reflux think, oh, I have too much acid.
Yeah.
But is that true?
Not necessarily. So there are a couple of things to consider with that. When you reach about age 50, one of the statistics I saw was that you have about 25% of the stomach acid you had when you were 20.
Really?
Yeah, so your stomach acid changes, your enzymatic activity as far as your digestion, all of that begins to decline as you get older. And the thing to keep in mind relative to that is that you can have acid reflux symptoms for a variety of reasons. One, it could be too much acid. It could also be too little acid, meaning that you're not breaking down the food properly, and then it's like fermenting and not, you know what I mean? It's just, it causes that gas, and the gas pushes up the lower esophageal sphincter. You have reflux come up. There are various things, like as people gain weight around their midsection, like when I was pregnant, air would make me have acid reflux. But it was basically because of the mechanics of what was happening where the baby was seated. But I see that a lot with people as they gain more weight around their midsection. It's pushing on things, and that's triggering it. And any level of acid is going to feel uncomfortable coming back up. But there are various medications that soften that esophageal sphincter. Some of the blood pressure medications do.
Okay.
You can have the physiological changes based on girth. But the other interesting thing that I have seen with a couple of clients who were diagnosed with hiatal hernias that developed, one of which developed after she had bronchitis and was coughing a lot.
Oh, interesting.
But another woman was put on all these medications, and eventually she actually had to have surgery for it, and everything disappeared. So, you know, can you have it from too much? Yes. Can you have, but really that, if you really want to assess that, you're getting a gastroenterologist involved, but they're not going to do that assessment on an average everyday person. They're just not. They're going to recommend some type of medication to reduce acid. Now, is that medication important? For some people, absolutely it is. I would never tell anybody that's having that level of reflux to not take something to protect their esophagus, especially if they have like Barrett's esophagus or they have ulcers or whatever else. But by the same token, I think that maybe you need to look at what are you eating that's triggering it. One of the big things that's out there is mint. Mint and alcohol also relax that sphincter.
Yes, I've heard about that, yeah.
And as a result of that, then people get reflux and they're like, oh, I need medication. Well, maybe you do, maybe you don't. Maybe you just need to cut out the Altoids. I had one woman, I had her cut out the Altoids and it disappeared.
Oh,
because she was popping Altoids.
Yeah.
After each meal. And then she couldn't understand why she was getting reflux.
That's so funny.
And I'm like, you're the Altoids.
That's one easy fix.
Fix. But, you know, so how can you tell what category you fall into? There are a couple of tests that you can do out there. There's one where you actually take in BT and HCl. That should really be done under the guy's, supervision of a practitioner. Because if you take it in and you immediately feel burning in your stomach, you've basically just added more acid in. And then you truly know that you have enough acid, you have too much, you're producing whatever. The other thing that you can do is do like half a teaspoon of baking soda.
I heard of apple cider vinegar too.
We'll get into that in some water, and if within like 1 to 2 minutes you start burping, you're good. If you're 3 to 5 minutes and you haven't produced a burp, or you just then burp, you probably are lower on stomach acid. Apple cider vinegar, as far as to treat that, one of the things that apple cider vinegar can be very helpful with, aside from blood sugar regulation, it's fabulous, is to help kind of balance the pH in your stomach. The other really big thing that I see with people, like what can we do to kind of help this, is to you know, one, I would say with any of this, don't self-diagnose. Work
Yeah.
with a practitioner on it. The other thing is begin some mindful eating, you know, because a lot of people are eating on the go, or they're eating when they're stressed, and they're underestimating that nervous system
Yes.
response. You know, we have the fight or flight or rest and digest.
Yeah.
If you're in fight or flight mode, guess what? Everything's getting turned down for your rest and digest, which means anything that you've got going on in your GI
like,
system
no.
is going to be turned down. It's just going to be
Makes
turned
sense.
down. So slow down.
Yeah, or like eating, like you said, eating on the go, eating while working.
Yes.
Not really paying attention. And there was like, there's an old saying that was like, my husband always says this to me, he's like, does your stomach have teeth? You have to chew your food.
Yes.
That's another thing.
Chew your food.
Yeah.
Get those signals working that your body knows that it's accepting food. Slow down. Chew, smell, observe your food. I mean, if you look at different cultures, they make a meal, it's more of a sacred event versus going through the drive-through and shoving it while you're on your commute and not even thinking about it.
Or like on the go, fast food, all that stuff. So just to like summarize some of the main points and what I'm understanding, all this good info you're giving out. Acid reflux may not necessarily be from too much acid.
Correct.
Yeah, under a guided practitioner, you can check if you have too much, too little.
Yep.
Could be a mechanical issue with
Correct.
the sphincter if you're doing things that relax the sphincter, such as you said, blood pressure medication.
Some blood pressure medications will do it.
Also mint, alcohol.
Yep.
So checking those things, making maybe stopping it and just seeing that. I feel like that's safe to do. You can also check using the baking powder,
Baking soda.
and the betaine.
The betaine HCl.
Yeah, but again,
I would do.
Yes, because you're adding acids. So
yeah, and if you do apple cider vinegar, I recommend just starting with like a teaspoon and about 8 to 10 ounces of water before a meal, just to kind of help aid the digestion. You can also put it over a salad.
Yeah.
You know, something like that.
I heard about that too. So those are kind of the main points with acid reflux I think people can find useful and to talk to their practitioner about.
Yeah, and I think the one other thing that I really want to get out there and put out there as far as stomach acid isn't a bad thing. We actually need it.
Yes.
We need it specifically, you know, like we need to break food down and be able to absorb things like B12 and iron and you know, various other minerals and things like that. You need stomach acid. Stomach acid is also one of the first lines of defense for your immune system, right? So
if you don't have enough,
correct.
that's a problem.
It's a problem. And the acid-reducing medications, by definition, may also predispose people
to sickness.
To sickness. They're not getting as many nutrients. They also may be more at risk for developing things like small intestinal bacterial overgrowth.
SIBO.
Yeah.
I hear
So,
that a lot.
you know, stomach acid's not a
it's not a bad thing.
No.
Let's do mindful eating.
Mindful eating.
Yes.
Yeah.
I feel like we don't have enough time. So we're going to go. Let's do the fun segment was the overrated, underrated food.
Overrated and underrated food.
You can kind of do quick on this and maybe do a quick blurb if you want for each one. So let's do this. Be fun. Okay. The saying "apple a day keeps the doctor away." Apples.
Love apples. They're a great source of fiber. And, you know, the thing to keep in mind with anything that I'm saying that it falls in the fruit and vegetable category, don't peel your apples.
Okay. Oh, yeah, because it has the fiber. Right?
Fiber, but also different levels of phytonutrients exist in the skins of these.
You have to wash.
You have to wash.
Get organic.
Yeah, get organic, wash. Make sure you're eating it, but love apples. Apples are fabulous.
So apples, underrated. It's funny. Oregano oil.
Oregano oil. So oregano oil, sometimes people willy-nilly take it, and I get very concerned about that because it is almost like a natural antibiotic. And if taken over an extended period of time, I mean, one of the reasons people will take oregano oil is to treat.
Yes.
bacterial imbalances in the body. And so if you think about it, just like in an antibiotic, if it's killing off stuff, you don't want to be taking it for long periods of time. So very potent. That is
overrated.
I think it's underrated for people that don't know about it, but
overrated for people who use it too
yes, and overrated for people who use it.
You went in the middle for that.
I'm in the middle for that one, but that is another one that I would do under the supervision of a practitioner.
Yes, absolutely. Because then I remember you told me can change the microbiome.
Yes. Yep. And I actually found some studies on that.
Oh. That's awesome. Yep. Sweet potatoes.
Love sweet potatoes. They are one of my all-time favorite. Like, can you tell I have a soft spot for sweet potatoes?
I can tell.
I love sweet potatoes. So sweet potatoes are totally underrated.
B6, lots of B vitamins.
B6, lots of B vitamins, vitamin A, the beta carotene. They are fantastic, and they have lots of fiber in them too, which is also really good.
Now, you talked about this, sardines.
Oh. Sardines and liver are two underrated foods. Be honest, I can't eat either. I just can't. I've tried.
Ate sardines a lot in college. So
did you?
Yeah.
They are a fantastic superfood. They are packed full of nutrients. They're great with omega-3s. They're wonderful. Liver, if you go back to traditional cultures, they all do the organ meats. They're very nutrient dense.
Yes.
High amounts of vitamin A, high amounts of iron. They're just fantastic. I cannot do them. But for people that really have, they may have an iron-related deficiency or insufficiency, I might do desiccated in a pill.
Okay.
Liver. You can also do, the only way I've been able to tolerate this, you're going to crack up. Because in my program, we actually had to do cooking classes. One whole weekend was organ meats. Is you take cow's liver and then you freeze it and then you shave it off into a glass with tomato juice and horseradish, and then you do a shot.
Oh my gosh. I don't know if I could do that.
And the idea that, I know the grade they did, much like sushi, they were very careful, make sure, whatever, but I was just like, I can't. So underrated.
Underrated, yes. Liver, not many people actually do. I've cooked with chicken liver before. Interesting. Avocados.
Avocados packed with B vitamins, so good for you. Healthy fats, they keep you full longer.
Excellent.
They're fantastic. Turmeric, very good anti-inflammatory, stimulates all of that. The only thing there is for some people, if they have like an iron anemia, that they should be cautious with turmeric.
Turmeric, okay. And then there's a lot of different ones.
I know.
But this is more of a life.
One thing I will say, pomegranates,
yeah.
Nectar of the gods. It's so good for you. And they're fun. You can put them in like beverages with like seltzer water, and you can consume them that way.
Superfood too.
Oatmeal. You can put them with oatmeal. It's really good. You can put them on salads this time of year. They're like really pretty on salads. Thing to keep in mind, the recent studies show that they may be, from an enzymatic perspective, much like grapefruit. For some people that are taking medications, that they may have a similar effect. So like when people see stuff, they're taking medication, don't do grapefruit. It's the same type of thing.
Oh, I see.
With pomegranate.
So a little caution there.
Oh, and good for blood pressure lowering.
Good for blood pressure. All the good stuff.
All the good stuff.
All right, I think, is that it? Okay. That's all we have. We had
a lot.
We didn't even get through like half of the stuff. It's okay.
It's next time.
But thanks for joining us, and I'll probably bring Tina Brockett back on another time to talk about.
That would be fun.
Yeah. And come here and hang out with me.
Imagine that. Thank you so much for having me.
Yeah, this is fun. Oh, and I wanted to spiel on your course, but we can do that another time. I'll do that.
That's fine.
Yeah. So.
Okay.
Do you want to talk about your course a little bit?
I'll just say real quick, one of the things that I put together, and this was really working with my client population, is an anti-inflammation course, because inflammation is the root of many chronic disease states, including like strokes and cancer and metabolic issues, blood sugar dysregulation, etc. And most people don't understand what foods contribute to inflammation in the body, what inflammation is, how different foods can be used to help reduce inflammation, how lifestyle changes positive and negatively impact inflammation. So anyway, put together a course on it. There's a self-directed one, and then 3 times a year I'm running a guided session.
Yeah. So I'll definitely link you guys to that, to the course. You guys take a look at that and see if you're interested, because who doesn't want something to help reduce inflammation in their body and promote, their well-being. So
sounds great.
Thank you for joining me.
Thanks for
having me. So much fun. Cut.